Chemotherapy kills not only cancer cells. Some of those cells are the immune cells of our body. During such an intense treatment, you're extremely vulnerable to any infection. I got neutropenic sepsis. That means sepsis in a patient that does not have white blood cells. You need antibiotics to save your life at that point. My husband and I are both medical doctors. We met each other in medical school. Our son, Eivind, goes to kindergarten. I work at the Department of Orthopedic Emergency at Oslo University Hospital, examining and treating patients and also quality checks, going over x-rays, going over treatments. I found a lump in my right breast. I hadn't felt it before, so I decided the day after to get a colleague to refer me to a breast diagnostic center. It still looked benign on the ultrasound, but they took several biopsies. A little more than a week later, we got the results. It was non-Hodgkin lymphoma. I went from being a doctor to being a patient, and nothing turned out the way that I had planned and hoped for. We spent the weekend together as a family, just trying to spend as much time together as possible. Long talks, long walks. We got married 2 days after my first chemotherapy session. I finished chemo about 3 months later, was declared in remission. I started feeling numbness around my waist and started getting weaker from the waist down. And within 2 weeks of those symptoms, I was in a wheelchair. This secondary cancer had entered my spinal cord and paralyzed me. Chemotherapy wiped out all circulating white blood cells, and then I got sepsis. When I was given antibiotics, the first type that I got did not work. I got very sick. I felt like I didn't have a body to live with.
Chemotherapy reduced the number of white blood cells. A cancer patient has a risk of dying from a fatal infection that is 3 times higher than an individual without cancer. Antibiotics are required to support patients with infection. Antimicrobial resistance diminishes the ability of antibiotics to treat and prevent the infection, and so a patient have a higher risk.
The multidisciplinary approach is very important for oncological patients and in general for immunocompromised patients. We have a tradition of this kind of approach, fighting cancer and infection together. The expert in oncology, specialists in infectious diseases, also pharmacists, that all work together. It's really important to have a team dedicated to the antimicrobial stewardship to control the spread of resistance, bacterial resistance.
Mia mamma era una persona molto premurosa, in quanto madre di un'unica figlia, quale io sono. La classica mamma italiana. Io con mia mamma eravamo soliti vederci il pomeriggio per fare lunghe passeggiate. Era una persona sanissima fino a quel febbraio del 2020. Gli hanno diagnosticato un tumore all'utero. È stata operata il 26 marzo e il tumore è stato completamente rimosso. A ottobre di quello stesso anno, dopo 6 mesi, mia mamma ha fatto la sua prima, TAC, dove purtroppo la malattia era salita a livello pelvico, con ostruzione delle vie urinarie. Dopodiché mamma ha iniziato a fare la chemioterapia. Sono iniziati in quel momento sia la febbre molto alta e sia delle infezioni a livello urinario. Non stava per nulla bene, l'oncologa gli ha prescritto degli antibiotici che non facevano alcun effetto. Mia mamma è durata ancora 2 giorni, è mancata il 10 febbraio del 2023. È mancata per l'infezione più che per il suo tumore. È diventata resistente all'antibiotico.
The infection of the patient was with 2 types of bacteria, 2 aggressive bacteria resistant to antibiotics available at that time.
One of the most important part of my job is a good relationship with the patient and with the families.
E allora come stai?
Bene, tutto a posto, periodo difficile, lungo.
We try to have always a clear communication to support every step of the disease. I built a good relationship with the relative of my patient. With Marcella, there is a real friendship.
So in general, antibiotics in many situations can improve the survival of the patients. However, we are at a certain point in which we need to do something in order not to go back to the pre-antibiotic era. And everybody can do something. Doctors should prescribe antibiotics more appropriately. Antibiotics should be used only if there is a diagnosis of bacterial infections according to the recommendation of the doctor.
When I relapsed, I was quite fearful that I wouldn't survive. I had to change to another antibiotic, and then the fever gradually went down. The cancer treatment could be continued. Antibiotics saved my life. It was nice to have something to keep my hands busy. I knitted sweaters for my son in bigger sizes in case I wouldn't be there, so that he wouldn't be able to forget me. Now I feel that more and more things are within my reach.
Yes!
I am getting back to work, back to social life and family life, most importantly. Life is good.